policy for all employees. So any employee that is not vaccinated would be required to test weekly for COVID, and we are required, as he said Friday, Illinois OSHA just released their timeline. We are required to have a policy in place by February 24th, 2022 that requires this, unless the Supreme Court issues something that surprises, and maybe doesn't surprise some people, but unless the Supreme Court issues something that changes, that's what we're required to do, is put a policy. We're required to not only implement, but also put it in place and enforce it. So that's kind of where we're at. So beyond just that, there's also a lot of little things that go in with that we are required to determine the vaccination status of every employee. And any employee that claims they are vaccinated, we are required to obtain proof. That's where she comes in. I know a lot of you may have already received some emails. Several of our employees should have already received emails. Some employees are responding, some are not. Hopefully, they will all respond accordingly. So we're required to obtain vaccination status of every employee. We're required to provide support for employee vaccination. We're required to provide notice of positive, or require employees to promptly notify us anytime there's a positive COVID-19 test or diagnosis. We're required to remove any employee who receives a positive COVID-19 test or diagnosis. We are also required, any employee that is not vaccinated that chooses the testing policy, we are required to make them wear face coverings and masks anytime they are indoors or when occupying a vehicle with another person for work purposes. The only exception to that is it interferes with with the safety measures of certain equipment, like our firefighters, when they're wearing their equipment and their masks, they would not be required to wear a separate other mask. I think there's some other notices that we're required to put up within the workplace. She has requirements on her end for record keeping that are also very elaborate. Obviously, there's confidentiality with those records, so she's got a lot of things that she's got to follow with that as well. But unfortunately, it's required, whether you agree with it or not, you like it or not. I know everybody has their own personal opinion. It is what it is at this point. There's a chance that once the Supreme Court, they could issue another stay. If they do, then the chances are likely that Illinois OSHA will also stay enforcement of its standard. But until we hear from Illinois OSHA, at this point, we have to push forward. Does anybody have any questions? Does anybody have any questions about the program?
I don't have a question about the program, but I do have a question about something I heard. I don't know if it was Friday or Saturday. I don't know if it was CDC. I think it was CDC who put this out. That now says if you are vaccinated but positive, you can work as long as you have a mask and asymptomatic.
Yes.
Is that right?
Yes.
So how does that fit into this? Because to me, this is saying if you're positive, you're out of here,
Those
right?
new guidelines are a little tricky.
So are they kind of
Yeah.
in each other's face with that?
A little bit, yeah. I think that's the problem, is you've got OSHA trying to develop the guidelines to go with this new standard, and then you've also got the CDC that's constantly updating and developing their policies, and they're not always on the same page, unfortunately.
So which one do we?
Well, right now, we're following the CDC guidelines that we got
Yeah.
last week, 2 weeks ago. So it's
Yeah.
the 5 days, depending on when you were vaccinated,
Okay,
if you are, if you aren't.
right.
It's basically looking at a chart every single time
Yeah.
to see where they fall. It's
Okay.
crazy.
So currently, what's the date in which we have to comply?
February 24th is when we are required to have our policy in place. And that's also when we're required, essentially, for her to have an idea of who's vaccinated, who's not. Everybody should have submitted, if they are vaccinated, submitted their proof of vaccination at that point. And then March 25th is the date that we are required to begin testing of any employees who are not vaccinated. That's the drop deadline for Illinois OSHA, that we should have our testing procedure in place.
And let me ask you a question about the definition of vaccinated. What's their definition of vaccinated now? Is that first shot, second shot?
Second, so,
booster shot?
yeah, so their definition of vaccinated, if it's a 2-dose vaccine, then you're considered fully vaccinated 2 weeks after your second shot. If it's a one-dose vaccine like the Johnson & Johnson, you're considered fully vaccinated 2 weeks after your one dose.
Okay, so they're not requiring another boosters?
At this point, the
Yeah.
boosters are not required for the standard.
Okay.
No.
Would they have to change? There's a lot of talk about what the definition of fully vaccinated is, and that seems to be morphing. Is there, in this ETS, can they just change that definition on a whim, or is that codified in the emergency temporary standard itself? In other words, if CDC changes that definition, does this automatically change? And then we've got to go back to employees. I know some people that are very hesitant based on some other things that have gone on to get the booster, even if they've been double jabbed, so to speak, and that's a concern. So if they change the definition on the fly, do we have to go back and tell them, okay, now you were fully vaccinated, but now you're not?
I think there's a process they would have to go through to change since it's already codified in the emergency, but because it is emergency rule, it may be able to be amended a lot easier than a final. I don't know if a final rule has been put out yet. I would imagine not, because I think that's usually a 6-month process because it goes through several steps in the administrative rulemaking process. But I believe it is they do mention the definition in the emergency rule. So I think there would have to be a process to amend that. It wouldn't just be an overnight thing.
Okay.
And can you go over one more time what the fine is for us non-complying per day? I know it's too much. There's a number there.
There was a number. I want to say 14,000 a day
A day.
that we're not in
It's a little
compliance.
over 14,000.
Is it? I was, for some reason I have 14,000 in my mind, but I don't
I
have.
thought it was
the number
13,650. Let's not exaggerate. I mean,
Exactly
I was thinking it
in
was
front of me.
13.6 also.
but they can also apply a fine of 10 times that amount if you have been found to be, I can't remember the language that they use, but grossly flouting, if you will, the rules, or if it's a repeated offense. So, I mean, they could cause us all kinds of havoc very quickly.
Yeah, I don't see that we have a choice in this matter, period, regardless of what we think is right or what our beliefs are. What I don't understand, and I need somebody to explain it to me, and I'm not asking you guys to, I just don't get how somebody that is not vaccinated is required to test every 2 weeks and wear a mask
Every 1 week.
every 1 week
Yes.
and wear a mask, but yet if somebody is vaccinated who can get COVID again and can transmit to somebody, they're not required to test or wear a mask. That makes no sense to me whatsoever. And I get it. You guys didn't make the rules up,
Yeah.
but I certainly would like to talk to the person that did and figure out the logic path on that one. Because I guarantee it's crooked. I do not get that one. But I understand it's something that we have to do. We may not like it. I don't like it, but it is what it is.
And just know, whatever you guys decide tonight, depending on what the Supreme Court does, if all of this does end up going away in the future, this can always be repealed. So, and of course, it may get amended in the future as new
Yeah.
guidelines and new updates come along as well, which is why we also put one of the provisions in the ordinance that the mayor has the authority without full council action if we need to amend our policy to update some new change that just gets put out, that he has the authority to do that and send it out to the employees without having to take time to do a council meeting on it, things like that. Because we do expect these to at least be amended and updated.
Well, frankly, since we typed it all out, it changed
Yeah.
from Friday night changed Friday night.
Yeah.
So we put the agenda out and the policy together and had it all ready to go, and it changed that night. So, I mean, and I'm concerned that's going to be exactly the trajectory of this.
I would like to just make a comment. I am totally against mandating anyone to take a vaccination. I'm totally against requiring people to divulge their medical history and anything about their medical, but given the circumstances, they've pretty well got us over a barrel because we can't afford $13,600 per violation per day to fight this. The only thing I can say is elections have consequences and people need to, I'll leave it at that.
That is a good point, because the question just came up about HIPAA, and this doesn't violate HIPAA whatsoever.
Well, it only doesn't violate because
You're not providing
we're
any-
not.
Requesting
yeah.
vaccinate, we're.
It's
yeah.
because who's asking
Yeah.
for it.
Yeah.
Vaccination status is not a HIPAA violation, just, and a lot of our employees have tried to argue that and claim that it's not. Whether you're vaccinated or not is not a HIPAA violation, so.
Just for the record, I'm still not, and I'm not, this isn't directed to you
Oh, I
guys or anybody
understand.
here. Probably everybody feels the same. This is totally against what I believe, but I see we have no other recourse.
Except at the election polls.
That's right.
I will say that the departments have been very good at getting their employees to register, so. Now we have 210 out of 351 that are active, so they've gotten on the portal and registered. So, just because they got on there, doesn't mean they necessarily put in if they are vaccinated. That's their choice. If they don't, then they're still going on the testing list, so.
Yeah, so
we're about
essentially,
45% with the
if an employee refuses
registered
to
vaccinated.
answer whether they're vaccinated or not, that just means they're going to submit to the required testing.
Well, I hope all the employees realize that this isn't something that you guys are trying, and
I hope.
treat you with respect for doing your job,
So
basically.
far, I think most people understand it's not us. I think I mean, they've watched the news. They see what's going on. I think they realize it's the government above us,
Right.
and OSHA, and that we're unfortunately have no choice in the matter. And we're literally waited till almost the last minute, hoping that something would change, and it just hasn't yet.
Right.
And the Illinois OSHA standard goes into effect, so we have until February to put our policy in place, but the Illinois OSHA standard is effective as of January 24th, which is one reason why we wanted to get this passed prior. Because at the time we contemplated putting this on the agenda for tonight, we didn't know what Illinois' dates were going to be, other than the January 24th date.
Okay. Well, the only thing I have to add to what these guys said is that I'm going to bite the bullet and I'll make the motion because nobody else is going to want to. I'll also say I'll happily make the motion to repeal it should the opportunity
Amen.
present itself. I don't think it's, and all I can ask is that, as you said, employees try to understand the ever-changing nature of this and how hard it is to navigate. I've watched Jessica and Wendy, and myself for that matter, and Cody just go home exhausted after trying to understand it all. And we still have a whole lot to figure out, by the way. One of the most immediate challenges is maybe it will be relieved by the time March rolls around, but everybody knows there's testing shortage, and that's going to be a challenge. Not exactly sure how to navigate that and what happens if there's no tests available when we need to implement that regime. So
Did they specify, I'm sure this is rapid, right? Or is this not rapid test? PCR?
and choose.
So you can
If
choose,
you
you can
want.
even do at-home tests.
Oh, really? They'll take.
The only thing with that is it can't be self-administered and self-read. So if an employee chooses to do an at-home test, they can self-administer the test, but then they have to give it to somebody else to read.
Do they specify who that has to be?
No,
Spouse, child?
I don't remember that.
I don't know that it, well,
What
I
could go
can't,
wrong there?
Yeah.
I don't think it can be within their household. I think it has to be somebody else within the employer,
Okay, all right.
I think,
or somebody established for that purpose.
yeah, I thought it had to be a medical
Yeah.
professional of some sort.
I did send something out today because they were asking about the return to work guidelines with this new 5-day situation. And home tests are not reported to IDPH, which is now who you're getting your release from. You don't even get a release anymore. You go through that portal, because Bi-County's
Right.
out of the loop.
Right.
So,
Well, it's interesting too, because, we report to Siren every day. And we talk to Public Health, Illinois Public Health, every day. And what they're reporting to us and what we're hearing locally are two totally different stories. About how many, we got one saying that we have no Omicron in Williams County at all, 0. And another one saying it's rampant. Well, somebody's wrong. And
So which one is saying which?
the state is saying there are no cases in Williams County, 0.
So that what they're saying what we're are testing positive for is Delta then? Is that what you're,
They're not saying anything. They're just saying that we have no reported Omicron cases in Williamson County.
It's my understanding
south
they
as
have to,
Perry.
they have to send those tests off to a pathologist to determine what variant
Well,
that
and
they're looking
that's
at.
just it. Most
And you
of the
know
time-
they're not doing that.
No, most of the time when you get tested, they're not going to that level. So either around here, they're not reporting it, we're not taking it the next step, or there just aren't any. But now SIH, on the other hand, is saying, because they're geared up already with the new Omicron, antibody infusion. They're not even doing Regeneron anymore. We've gone on to the next model. So it's extremely confusing, even within the state.
The numbers that I heard were opposite of what was being reported as far as Omicron versus the Delta
Delta,
variant.
yeah.
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 Opposite of, in southern Illinois,
Right.
or in our area, I guess.
But I mean, we just literally got off the phone with Illinois IDPH today, and
Yeah.
they're still saying, no, there are
So-
none.
I think it all depends on the narrative that you're wanting to spin.
It's also confusing.
And just to go back to
Possibly.
your adequate testing, so there's actually a question on that in the frequently asked questions section of the standard. It basically says that OSHA has determined there are sufficient COVID-19 tests available and adequate laboratory capacity to meet the anticipated increased testing demand related to compliance with the standard testing requirements. However, in the event that an individual employer is unable to comply with paragraph G of this standard due to inadequate test supply or laboratory capacity, OSHA will look at efforts made by the employer to comply, as well as the pattern and practice of the employer's testing program, and consider refraining from enforcement where the facts show good faith in attempting to comply with the standard. So if testing supply becomes an issue, I guess we'll have to show that we're at least making a good faith effort to comply.
And who makes that subjective call?
OSHA.
Great. I feel better.
okay. Regrettably, it's my motion to approve ordinance 3767, which establishes the city's policy per OSHA's COVID-19 emergency temporary standard.
I'll second that.
Okay, roll call, please.
Commissioner Patton,
I don't like being first. Yes.
Commissioner Barwick,
Reluctantly, yes.
Commissioner Stecklin,
Yay.
Mayor Absher.
Yay. Commissioner reports. Doug, you got anything?
Not
Thanks,
worth
Wendy. Thanks,
reporting.
Jessica.
Thank you, yeah. Not worth reporting today. Maybe next time we'll get into a couple things.
Okay. Commissioner Barwick?
Yes, the December animal control report, we had 150 calls, 39 at large dogs, 8 aggressive dogs, 13 well checks, 15 wildlife pickups, again for a total of 277. The fire department for December 21 had 10 fire calls, 11 rescue EMS calls, 16 hazardous conditions, no fire, 13 service calls, 10 good intent calls, 14 activated alarms, for a total of 74, and we conducted 25 annual safety inspections. Marion Police Department activity report for December, 100 city ordinance violations, 32 warrant arrests, 329 incidents reported, 198 traffic accidents, 4 DUIs, total dispatch calls 6,533, total 911 calls 3,170, and there were 346 ambulance calls. For the entire year of 2021, we had a total of 727 city ordinance violations, 262 warrant arrests, 4,220 incidents reported, 1,946 traffic accidents, and 98 DUIs. There were 59,845 dispatched calls, 38,107 911 calls, 4,332 ambulance calls. Marion Police Department Detective Unit had a total of 29 cases for the month of December. Out of that 29, we had 10 burglary, 5 theft, 2 theft of motor vehicle parts, and then 1 death investigation, several other aggravated unlawful use of weapons, criminal damage to property, that type of thing. Marion Police Department Narcotics Unit for December 2021, 89 cases initiated, 107 total citations, 56 arrests, 17 warrant arrests, seized 72 pounds of cannabis, 35.7 grams of methamphetamine, 27 grams of a controlled substance, 5 doses of MDMA, 2 doses of LSD, 16 firearms, 2 search warrants were conducted, cocaine, 4.82 grams was seized, 4 controlled purchases, tobacco seizures. There were 4,445 packages of cigarettes and 259 electronic cigarettes. 3 grams of cocaine was seized, and 1 arrest for driving under the influence of alcohol. And that's all I have.
John?
All right, so Water Department for the year 2021, we had 60 new service taps for the year, 39 water main breaks, 32 water service leaks, 145 services were updated, 5 fire hydrants were replaced or added into the system, 8 new construction and operating permits for new or replacement of water mains, 93 meters and/or meter pits repaired due to damages, 5,356 service calls, 3,336 Julie location requests completed, which is an average of about 270 Julie locates a month. Numerous other jobs besides that. And for the year, we pumped 661,628,000 gallons of water out to our citizens. So great job to everybody around there. Reminder, the City Hall is closed this coming Monday in observance of Martin Luther King Day. And also, this Monday, join the City of Marion for the annual Martin Luther King Jr. Luncheon at the Pavilion. Luncheon starts at 11, and we're being told that a good barbecue lunch, great barbecue lunch, will be provided. So that's this coming Monday.
Okay.
That's all I have.
I don't have a report from my departments this meeting. Anything else to come before the council under miscellaneous tonight? You have something, Chief?
Do you think maybe you or I one should kind of lean on the conscience of the public, the traffic problems at SIH are there?
Yeah, would you mind to come up and let Terrence get you on camera and discuss what you're seeing out there too? Appreciate you bringing that up.
With the uptick in all of the positive cases, the number of people that are getting tested now has dramatically increased. And with that, all the citizens going to SIH to get tested are, I want to believe inadvertently, blocking the entrances to the little strip mall across from Walmart, which would be where Ty-D, the dentist office, Cato, and a couple other places. So the mayor and I both implore all the citizens around here, when you get tested, please leave those entrances to those businesses open. When you sit there that long blocking them, they lose business, and that is not fair to them. We know you're trying to do the right thing by getting tested, taking care of yourself and everybody around you, but you are hurting those businesses, so please help us. We don't have enough officers working at any one time to dedicate somebody to traffic detail like that. So, thank you.
On the heels of that comment, talking to SIH about this last week and today, he reminded me, and I'll remind you guys, that they have another testing facility on Reed Station Road at the warehouse there. So if you do not have an appointment at the Marion facility and you want to utilize SIH, then go to Reed Station Road. They do, I presume, have appointments or openings there. And also, please keep in mind that the testing facility at Heartland is also open, and I think they open pretty early in the morning. I'm not sure exactly what time. 7? 7:30, and that's just on the back side of the hospital. And you can certainly utilize that too. I don't know if other places have resumed, like Walgreens and places like that, but there's other opportunities other than waiting at SIH. There's multiple opportunities with SIH and with Heartland as well. So please, if you find yourself in that scenario and need to be tested, don't just go to one facility and wait. There's other opportunities out there. So appreciate you bringing that up. Anything else under miscellaneous? Any of you have need for a closed session, executive session tonight? Okay, hearing no need, I would entertain a motion to adjourn the meeting.
I'd make a motion that we would adjourn.
Second?
Roll call, please.
Commissioner Patton,
Yay.
Commissioner Berwick,
Yay?
Commissioner Stecklin,
Yes.
Mayor Absher.
Yes. Thank you all.